Hey everyone, my name's Chris and welcome to Core 3 Wellness, where we specialise in injury rehabilitation and performance training. Now in this video, I just want to go through our simple process in how we work with individuals and just to give you more of an insight in what we actually offer and how we offer that. So first things first, with anyone that comes to work with us, they have a goal in mind. They have a goal, and that goal can be probably split into two. So it's either they want to get out of pain, or they either want to improve movement or performance. Now, when it comes to pain, it may be something from chronic back pain or neck pain, any kind of joint pain possibly, but also could be any pain relating to any muscle tightnesses or something to do with maybe the nerves possibly, they're feeling some sort of neural discomfort. So this is in one bracket, they want to be pain free. Secondly, it could be that they want to improve their movement or performance. So what I mean by this, it could be someone who just wants to be able to get down on the ground and play with the kids or grandkids with a little bit more ease. Two, it may be an athlete who wants to come in to help unlock a little bit more of their potential so they can up-level their game and perform at a higher level. So once we've got this goal in mind, that's great. This is where the individual wants to be. But in order to get to where we want to be, we need to understand where we currently are. And this is where our movement evaluation and kind of like a little bit of an assessment process comes in. So the movement evaluation, yes, we're gonna look at the site of pain or discomfort or restriction, but we also want to take into account any imbalances that could be contributing to that. So just as a very brief example, let's say someone is struggling with a little bit of neck pain. It would generally make sense to look at the site of pain, the neck. But again, as an example, I'm gonna look at the shoulders. I'm also going to look at the rib cage and the rest of the spine and even the hips, because all this has an integrated effect on the neck, again in this example. So let's say someone has neck pain, we find that their head is slightly forward, we find their shoulders are dropped down and pulled in. All this is going to create some sort of tension. And with that being said, just treating the site of pain may offer some short-term temporarily release and ease of pain, but it's gonna come back because we're not looking at fixing the root cause, which is what this movement evaluation is all about. It's about finding out where you are to get you to where you wanna be. So point A is where we are, point B is the goal that we've got in mind that we want to achieve. Now, once we've done this movement evaluation, then it's about designing that treatment program specifically for you. And this is where manual therapy comes in. Now, it's not a case of, okay, we have a pain, let's just hit it with some deep tissue massage. Now, don't get me wrong, sometimes that may be needed, it may be the case. But I like to think of all these manual therapy techniques as keys. I've collected all these keys over the years, but it's about combining it with the movement evaluation to get the right key that fits just for you to get you to this goal. So when I say manual therapy are just kind of techniques we do with the body to improve it and create balance. So as you can see, it can be from soft tissue work, deep tissue work, or sports massage as it's generally called, myofascial release, cupping, percussive therapy, corrective exercise. As you can see, that list goes on. So it's not a case of someone comes in and says, I've got a bit of pain, I want some myofascial release. That's all well and good, but for me, what I've learned over my 10 plus years of experience in this field is that sometimes we can actually start to stack our therapies, and I do this a lot. So stacking therapies means after our movement evaluation, or even in our initial movement evaluation and treatment session, it may be we go movement evaluation and then we get straight into some soft tissue work to bring a little bit of heat just to the area. Then we may go into a little bit of cupping to create some myofascial decompression. Then possibly some joint mobilizations to create a little bit of freedom in the joint possibly, and then maybe some corrective exercise to help stabilize and strengthen the new position. Now that's just an example, but what you'll find, and you can ask all our clients, I do tend to stack these therapies because they give the biggest ROI, or return on investment, of time. Now, I don't know about you, but I don't like wasting my time, and I definitely don't want to be wasting your time. So this is how our sessions generally are aimed, and with an array of this manual therapy work. Now from here, we actually start to create a program, and that program is laid out with short intermittent goals in place so we can actually monitor and quantify progress that we make. So I hope all that makes sense. Again, if you have any questions, please feel free to reach out. Again, if you feel that you're struggling with any aches, pains, or you want to improve that athletic performance side, please feel free to reach out. We can have a quick chat, and you can just ask a few more questions if need to find out if we're the right fit for you. So on that note, I hope you enjoyed the video, and until the next one, take care, and I'll see you soon.